Well, if you've ever been to the emergency room or the hospital for any reason, take a minute right now to honor some of the most important people who work there. This is, and we talked about this earlier this week, this is National Nurses Week. And to tell us more about it, we have Dan and Danielle. They are two nurses from Ranken Jordan Pediatric Bridge Hospital. Good morning and happy Nurses Week.
Good morning.
To both of you. Thanks for coming in. I just want to take a second and explain to people about Ranken Jordan. If they're not familiar with the facility, what's it all about? How is it different than other hospitals?
So how Ranken's a little bit different than a regular hospital is we have some kids who maybe be a little too sick to be in an ICU bed, but they're not quite ready to go home. So we really help facilitate like the transition from having kids with really complex medical needs going from the hospital to home and doing education with the parents and making sure they're all ready for a successful discharge.
Hence the term bridge. It's a bridge hospital. Okay, so back to Nurses Week. Happy Nurses Week. I think I said that already. Why do you think this profession is so important?
So I just want to take a second to talk about Nurses Week. So Nurses Week, why we celebrate is not only do we want to recognize our nurses and all the hard work that they do, but also we want to educate our community on our profession and what we do. And why nursing is so important right now is as a nation, we're suffering from a nursing shortage. And as our baby boomers are growing older, not only are they retiring out of their roles as nurses, but they're also, as a generation, requiring more care. And at Ranken Jordan, we're seeing the other end of the spectrum, where as healthcare and technology continue to improve, we're able to, more and more premature babies are able to survive after birth. And at Ranken Jordan, we care for these kiddos who might need a little extra help breathing or maybe have need help feeding. And
it's important.
It is very important.
Super important, and there's more kids because we're able to treat more kids. There's more need for nurses. What made you decide, Danielle, that you wanted to be a nurse?
Well, I always wanted to go into the healthcare field, and my first career was actually I was a card dealer in the casinos. Yeah. So I did that for 11 years and decided I wanted to go back to nursing school. My family's full of nurses, awesome nurses. So I knew I wanted to get to the bedside and be able to take care of patients, and being able to watch these kids go home after they've been pretty sick, to see them walk out the door is so rewarding for me.
I bet. I don't know that there could be anything any more rewarding than that. So how is the hospital celebrating Nurses Week?
So we're doing a lot of internal events and giveaways for our nurses. We just really want to make them feel appreciated, and we want to take care of our nurses just how they take care of our patients and make them feel special and appreciated.
That's great. Well, congratulations to both of you, and I hope you have many, many years of satisfactory, rewarding career, because that's just, it's a great way. And I talked earlier, I just think nurses are so important. If you want to learn more about Ranken Jordan Bridge Hospital or to learn about the job opportunities there, visit rankenjordan.org or give them a call at 314-872-6400.